video, we are going to examine the relationship between child mortality rate and the sum vaccination rate among a select group of higher income economies. The child mortality rate is the number of deaths of children under 5 years of age per 1,000 live births, while the sum vaccination rate is the share of 1-year-olds who had received at least one dose of a vaccine for any one of a select group of diseases, such as measles. We begin in 1980 with a wide dispersion of vaccination rates and child mortality across countries. Note that child mortality is displayed logarithmically rather than linearly. We notice a general downward slope in 1980, meaning we can observe an inverse relationship between the child mortality rate and the vaccination rate among these more industrialized economies. We continue to observe an inverse relationship between the child mortality rate and the vaccination rate over time. We also see that in individual countries, however, the child mortality rate falls even when the vaccination rate does not substantially increase, especially as countries near 100% vaccination. We also observe other instances where increases or decreases in the vaccination rate does not lead to significant changes in the child mortality rate.
Although global health efforts have been made to drastically reduce this tragic occurrence, it persists to be a problem. In 2019, an estimated 5.2 million children ages 5 and under died from diseases that are preventable and/or treatable. This number is certainly alarming, but considering that 12.6 million children died for the same reasons in 1990, it also demonstrates that significant progress has been made. One of the largest contributors to the decrease in child mortality is the increased access to vaccinations. Between 1990 and 2019, there was a 42.3% decrease in child mortality in the United States, a 63.2% decrease in Sweden, and a 79.3% decrease in South Korea. While the CDC admits the chance of children being exposed to all of the diseases it recommends to vaccinate against is rare, it is much easier for a child to fight an illness they already have built up immunity to.
In the United States, the rate of child mortality has declined from 1982 to 2019. Between 1994 and 2019, child vaccination rates have fluctuated between 94% and 96%. This is a decline from the all-time high vaccination rates of 97 and 98% throughout the 1980s and 1990s. In 1998, a study linking childhood vaccination to autism was released, and although it has since been debunked, vaccination rates have stagnated. In the U.S., vaccination is required for children to enter school. However, specific requirements vary between states, and in 15 states, parents can obtain a vaccine exemption for their children based on moral beliefs alone. This study plus this exemption rule has led to a rise in the number of anti-vaxxers who refuse to get their children vaccinated, which has contributed to the fall in vaccination rates. Vaccines are also not always free and accessible in the U.S., which has also contributed to this decline. The price to vaccinate one child in the public sector increased from $282 in 2000 to $1,894 in 2014. However, despite lower vaccination rates compared to the 1980s, child mortality has continued to fall and is lower today than it was even when vaccination rates were higher.
In 1980, South Korea had both the highest child mortality rate and the lowest vaccination rate among our select economies. Between 1981 and 1987, South Korea added more vaccines to its national immunization program, such as measles and polio in 1983. In 1981, South Korea's vaccination rate jumped from 4% to 62%, and it steadily increased to 93% by 1987. The child mortality rate fell from 35.8 to 20.1, and over the next several years, as the share of children under 5 who have been vaccinated rose, the child mortality rate continually dropped. The vaccination rate has remained at around 99% since 2000, but child mortality rate fell considerably since then. Vaccines for diseases not covered in the sum vaccination rate were introduced during this period, so vaccination rates may have increased during this time, even though we don't see this in our graph. Moreover, it is possible that the number of vaccinations South Korean children received grew, which would not alter the sum vaccination rate.
One of the most interesting trends that can be seen in our graph simulation is that child mortality in Sweden decreases over the 30-year period, yet their vaccination rates never increased. Sweden uses a national healthcare system that is overseen at both national and regional levels. All citizens are automatically enrolled, and 8 independent agencies oversee the access and delivery of healthcare and public health policies. The Communicable Diseases Act, under the Public Health Agency of Sweden, offers a nationwide vaccination program. This effort offers immunizations against 11 main diseases. Participation in the program is entirely voluntary and free of charge. Children in the program receive vaccinations beginning at 6 weeks old, and later doses are typically given by a healthcare provider in schools. Sweden was also one of the first countries to implement a tailoring immunization program in coordination with the World Health Organization in 2013. This program aimed to address the needs of areas within the country with low vaccination rates, better understand their needs, identify barriers to access from both the patient and provider perspective, and educate these communities on the benefits of vaccination in both Swedish and other languages.
As a general trend, childhood mortality has decreased from the 1980s to 2019. Above a certain threshold of vaccination, it appears that there are other factors that contribute to decreasing childhood mortality. This can be seen in the Gapminder graphs, where vaccination levels stay the same, but the levels of childhood mortality continue to fall. Firstly, the first 28 days of a child's life is the highest risk period for mortality. Increased access to healthcare and technological advancements have contributed to improvements in neonatal care, which have contributed to decreased mortality. Secondly, public health advancements have had a major impact on the rates of childhood mortality. The deaths of most children under 5 are caused by preventable diseases or diseases that are readily treatable with well-established and cost-effective methods. According to the World Health Organization, almost half of all child deaths are caused by undernutrition. Public health initiatives that have caused improvements in nutrition, sanitation, and hygiene contribute to these decreased mortality levels. The data has shown that vaccinations alone are not responsible for decreasing childhood mortality. Childhood vaccinations work in conjunction with other medical advancements and public health initiatives to help reduce childhood mortality.